So welcome to the next edition of Beyond the Couch, a hypnotherapy podcast where we deep dive into hypnosis and how it can help you. And today I am bringing you one of the very few hypnotherapists that's actually contracted by the NHS. And we're going to talk about hypnotherapy for cancer. So Garry Coles, your Hypno-Oncology, can you tell us a little bit about it, please?
Well, first of all, thank you for inviting me. Um, yeah, um, Essentially, hypno-oncology, hypnotic interventions for the cancer journey. And the first thing I will say for people that are already getting a little bit jumpy, and because there's some real dodgy people in certain countries that remain nameless, we do not work with cancer. We work with people going through the cancer journey. There is actually a 1939 Cancer Act that prevents you doing an awful lot of stuff unless you're an oncologist, a doctor, or a surgeon. So we don't work with the cancer itself. We work with people going through the journey. And saying that, we work with all aspects of the cancer journey. So I would see people from diagnosis to either cure or sadly going into hospice or death. So the type of things we would work with. We might work with the psychological fallout of the diagnosis, the fear, panic, and all sorts of things that will come with the diagnosis. Then we would perhaps work with fears and phobias. They might be frightened of needles, scanners, that type of thing. Then an area I did a lot of research in is pre and post surgical hypnosis to get a better recovery quality from surgery. The biggest area I work with is actually side effects of treatment. It might be anticipatory nausea and things like that from chemotherapy. Pain control, because obviously we know pain control is the biggest research thing in hypnosis with complementary therapies. I do palliative care work, and also life changes after things have happened, if you like, after the cure. And we also do experimental work. It's a bit of a mouthful, but there's a science or an area of science known as psychoneuroimmunology, which is the study of how feelings and emotions affect the immune system, which they do. There's lots of evidence there. And there is, and if we know that feelings and emotions can affect the immune system, we know that talking therapy, such as hypnotherapy, can affect feelings and emotions. So if you take that full circle, hypnotherapy can affect the immune system. And it sounds strange, but there is a lot of scientific research there to evidence that. So we do experimental work with the immune system as well. So that's sort of a quick a quick take of what I do with cancer and hypnotherapy.
So how did you get into working specifically? I know you deal with all sorts of
Yeah,
but
yeah. I'm a
specifically
full
can.
time. Yeah, I'm
Yeah.
a full time general hypnotherapist. It's one of these strange things. Even being a hypnotherapist was a bit of an accident, to be honest. Now, there may have been things, we have these unconscious ideas in the mind, and there may be something about that. I mean, I lost my mother, unfortunately, in her early 50s through cancer. So I saw her go through the whole journey, and that was long before I was a hypnotherapist. Um, so that may have had that. I nursed my grandfather through a cancer journey, so they might have all been playing in my mind, if you like. But what actually happened was I did a basic qualification in hypnotherapy. And then, of course, once you've qualified, you think, oh, I need experience now. I need patients, obviously clients, but I need experience. And out of the blue, a couple of weeks after I qualified, I had a phone call from an oncology unit at the hospital. They said, "Oh, we've just heard you qualified as a hypnotherapist. We used to have one here at the hospital. They've gone. It's really good with cancer patients. Would you like to come in and do some work with us?" And it was on a charitable basis at the time, and I thought, yeah, I'll do that because I was feeling a bit mercenary at the time, and I thought, yeah, I'll go in there because I'm seeing 9 patients a day. If that's going to put my experience through the roof. And so I thought, yeah, I'll go in there. I'll do a couple of weeks, and then I'll disappear. And that was that. Get me experience and disappear again. And that didn't really work because I was still there after 19 years. So that didn't go quite according to plan. It was only sort of one day a week, but for 19 years. And then it sort of followed on from there. Was I had the chance to be on the first cohort studying for a Master of Science degree in clinical hypnotherapy, and it was a research master's. and I decided to make it really difficult for myself. And I thought, well, as I've been based in the hospital for many years, oncology is now something I know because the hospital sent me on oncology courses and all sorts of other stuff. So I had a good background. I'd also worked with about 2,500 cancer patients, so I know what worked well and what didn't, and come up with my own approaches. So I decided to do research into that area for my master's, and I did a study into pre-surgical hypnosis and the effects that had on the recovery quality in breast cancer operations. I was able to demonstrate that it did, and how and why. And that sort of escalated, and it wasn't due to my research, but the Royal College of Anaesthetists now actually recommend pre-surgical hypnosis. They don't call it that, but that's what it is. And really, it was sort of taken a life of its own on from there, because I did my research, that got out, that sort of got me known. So I had people phoning me up or emailing me saying, "Oh, give me some advice. You're an expert. Can you give me some advice?" And then I was asked to do podcasts, then I was asked to do conferences, and then people said you need to put a training course together. So I've now got training courses and a book, and I'm writing another book, and so it's sort of taken a life on of its own, really. It's from what was an accident initially.
A very happy accident, and certainly for your clients as well. I mean, we've all got
Yeah,
our stories of how we got in, and I love the way they're all so different. Um,
yeah.
and obviously, I've seen you at a few conventions, which is why I've been really desperate to get you on here, because I know cancer is it's so prevalent, and
Yeah, that statistically it's quite frightening. It's people don't realise that basically since the 1960s in the Western world, 1 in 2 people will actually get cancer. That's 50% of the population. And but before we actually sort of started recording, when we were talking about prostate cancer and things, 1 in 8 men will get prostate cancer. 1 in 7 women get breast cancer. Bowel cancer affects 1 in 15 men, 1 in 18 women. Lung cancer, 1 in 13 men, and 1 in 15 women. So that's an awful lot of the population. And the other interesting thing is why I got into the oncology and why I teach people it is that, you're looking at 1 in 2 people will get it in some way or experience it. And 40, it's certainly in the US and the UK and Europe, 40% of people that actually contract cancer seek out complementary therapies. So essentially, you're looking at 20% of the population are after people like us to help them through the journey. It's a
and that's
lot.
amazing, because we know as hypnotherapists and hypnotists that even though the NHS appreciate what we do and understand what we do, they don't refer to us because they're not
No.
allowed to. However, can you explain the difference to me between a clinical hypnotherapist and someone like me who isn't a clinical?
I would say it's marketing, really, more than
Okay,
anything. Yeah, I mean, people call themselves clinical hypnotherapists and medical hypnotherapists and so on. Arguably, you could say that some people that might do, say, a solution-focused hypnotherapy course, they might concentrate on weight loss and sleep issues and anxiety, perhaps a little bit of anxiety and phobias. Whereas obviously I've done a master's degree, so we had to look at the background of lots of medical stuff. We had to look at the background of lots of clinical stuff, if you like. Things like IBS, for example, depression. I look at things like dystonia, which is sort of, spasms and things like that. And I had to look at the background of it. So those things I would say are clinical, if you like, or clinical or medical, as opposed to just more general. So I do call myself a clinical and medical hypnotherapist because I deal with issues that are both medical and clinical.
yeah,
Yeah.
and just to make people aware, if they're watching in other countries, we're not regulated in the UK, so we can call ourselves hypnotherapists. I know in some parts of the world you can't. You
Yeah,
have to be a
yeah,
hypnotist, but
yeah.
it's amazing.
In Florida, I'm a clinical hypnotist.
So in your work, in your line of work, what's sort of the most prevalent thing within the oncology world that you work with?
Probably. I mean, I do a lot of work of the sort of the panic and the fear of the original diagnosis. People tend to be very fearful, stressed, anxious, and so on. So that would be the first area. But probably, I would say probably the biggest area I work with is probably side effects of treatment. It's whether it's eating issues, whether it's pain issues, whether it's things like anticipatory nausea, neuralgia, all those types of issues.
Because I can imagine once you get that diagnosis, the big C as they call it, it's not a nice word, and just to be told,
It's a very emotionally charged word, you know.
yeah. So the sort of work you do on that with the acceptance of yes, I've got it.
Yeah,
I thought
yeah.
that's going
We
to be,
just we have to move people through the journey.
yeah,
You know, we're there to help them and guide them through that journey.
that's absolutely brilliant. So just tell me a little bit more about yourself then, as a therapist, how you put your spin on things, how you put your, because we all go through training, we all
Yeah,
do lots of training, and then we probably throw three-quarters of it in the bin because it's not, doesn't suit us, and that's,
yeah. Yeah, that is very, very true. I mean, I've been very lucky. I've had very extensive training from all sorts of people around the world. You know, I did all my NLP training with Richard Bandler, for example. I did my original hypnosis training with a doctor of psychology. Then I did it with a couple of other well-known names, and then obviously I did a master's degree, which was 4.5 years of training for that and research. And and yeah, and I see some people, and I've been on sort of mini courses, and I've been to a lot of lectures because as we've spoken about, you met me at sort of conferences and things, and I do a lot of conference speaking and presenting around the world. So I sit on a lot of lectures and things, and I've been trained by some people in their approaches, and it just doesn't resonate with me. You know, for me, I think no. Well, first of all, I'm very evidence based. I come from a scientific background anyway, prior to hypnosis. So I want evidence based. I want science. Yeah, I'm not against, you know, what they call the spiritual hypnotists, you know, or the airy fairy, or you know, angels and this, that, and the other. If that's their thing, fine. It doesn't resonate with me. Um, Now I've got other people that I think the way that their approaches work is because it's very much linked to their personality. So again, that approach wouldn't necessarily work with me because I haven't got that sort of personality. So I think what you do is you go and learn as much as you can, and then you do your own way of doing it. I mean, I've got ways that I work, and people ask me to teach them the way that I work. And yeah, I'll teach people the way that I work, and then say, right, now go away and do it your way. You know, take what you want from mine. It works for me, but I'm saying it works for me, but it doesn't mean to say that it's going to work for you in exactly the same way, because it's the way that I've devised it, the way I've changed it, the way that I'm comfortable with. That works for me.
I mean, obviously you see people with the same issues, which is cancer, which is a
Yeah,
huge subject, huge, but because they're all individual, they need to be treated individually.
absolutely. Yeah,
And so if I came to you as a first time client,
yeah.
I've, hopefully I never will, but what's your intake procedure into actually getting into how you're going to work with that person?
Well, again, this is in two ways. It depends if somebody's coming to me as a private client or whether it's somebody through the hospital. That both are different. Obviously, if I'm seeing a private client, I generally talk to them on the phone or there's an email exchange. And then when they come in, there's a huge intake form, and we discuss. I explain all about hypnotherapy. We go through the sort of medical and life history, etc., and what we're going to work on, and we go from there. If it's hospital based, of course, they turn up with a load of notes anyway because all this stuff's already been done on their journey. So I get to see, if you like, some of their treatment notes, and that's probably the first thing I see. And also, I'm very short of time in hospital because the NHS and everything is pretty short on time. So in hospital, really, I don't get a great deal of time to talk about their life and history, or even explain a huge amount about hypnotherapy. It's really, you know, I get to see their notes sort of a few minutes before they come into my office, and it's sort of okay, yeah, that's what they're being treated for. This is, you know, etc., etc., etc. And then it's sort of in the chair. What can I help you with? And then we go from there. So both are pretty different.
And yeah, I was going to say one of the things that I get asked is how many sessions.
Yeah.
Obviously, it differs person to person, but
It doesn't. It depends what you're working on. Again,
yeah,
you know, with cancer, for example, if I'm working in a hospital with a cancer patient, you might just do one session with somebody. You know, it might be what I call sort of an emergency intervention. They might be having a panic attack, so they've got to go into a scanner, something like that. So it's just a one-off, sort this now type thing. So in hospital, you probably do a lot of one-off sessions compared to how we would normally do, with what we'd say a normal client, if there's such a thing. I mean, typically I tend to work with people, say, for 4 sessions, but in hospital you do an awful lot of one-off sessions, but then you might have somebody that will have a lot of sessions over a couple of years because you're following them through the cancer journey. So again, you're working with the psychological fallout. Then you might be working with getting them into the scanner. Then you might be doing pre and post surgical work with them. Then you might be doing pain control after surgery, and then you perhaps, if they're then having chemotherapy, you're working with the side effects and so on. So yeah, it just varies hugely.
And probably the nastiest part would be, I suppose, be dealing with palliative care.
Yeah, I mean, I don't deal with a hugely amount with that, to be honest, because obviously in the UK we have hospices and so on, and being hospital based, yes, I would work with people in the initial part of it. If you like, if it's terminal and we move to palliative, yes, I would work with them if they're still coming into the hospital. Then when it becomes sort of end of life care, that moves into the hospice domain, which I don't work in. So,
But what about their families? Would you work with their families?
yeah,
You
yeah,
do, brilliant. So you
yeah.
offer a whole support package for the whole thing.
Yeah, because quite often, and particularly actually when you get to sort of end of life care, that stuff, it's quite strange. I mean, well, it isn't strange, but it might be to some people that obviously you've got a big thing. Cancer patients' fear of death is a huge thing. I find found when working with cancer patients that the fear of death is very prevalent at the time of diagnosis. Uh, Very big in the mind, very fearful. If you get to somebody that's then in palliative care, it's almost as though they've accepted it, and that they no longer have the fear of death. They quite often have a fear of what's going to happen to the people they're leaving behind,
Right.
but they haven't got the fear of death themselves. And then really the stuff then is working with the people that are going to leave behind, because they're having the stress and panic about, oh, what are we going to do when they're gone, and they're also worrying about them going and that type of thing. So the angle of approach changes as you go through the journey.
That's a massively interesting, very poignant note to end this
Yeah,
on.
yeah.
So, Garry Coles, thank you very much for your time. Absolutely love
Thank you
talking
very
to you.
much.
Learned a lot. Hope those people who are watching have learned a lot.
Yeah, and
If
as
they
I
need to
said,
contact you, obviously you've got your website up behind you.
I have, that's probably the best place to. I've got a few websites, but obviously, if they're interested in oncology stuff, whether they're a patient or family of a patient that wants help, or whether it's hypnotherapists that want training in it, because I do a lot of training, and they're both online on a USB card, in person, and so on and so forth. Lots of information on there. Yeah, it's hypno-oncology.com.
And
So
having seen you at a few conventions and seen your presentations and stuff, if you're a therapist, I would highly recommend your training,
thank you.
even if just to give you an overview of something that's massive out there and something people really don't like to talk about or
Yeah,
think, oh shit, there's
yeah.
that's it at the end.
Yeah, and interesting enough, actually, on that was another reason that we didn't touch on of how I got into sort of hypno-oncology training, putting the training courses together, was in the beginning, because I was doing my hospital work. I had a few people saying, "Oh, you need to put a training course together," and I thought nobody's going to be really interested in this. But what really brought it home to me was I was contacted by a couple of hypnotherapists that were very well qualified, very experienced, even compared to me at the time. But suddenly, as you said, the big C, it's a very emotional charged word. It's of, I'd get contacted of, oh, my mother, father, sister, so and so has been diagnosed with this type of cancer. What can I do? What can I do? And I think, but you're a really highly qualified, experienced hypnotherapist. Why don't you know what to do? And I thought, yeah, there's obviously there's a need here to educate even highly qualified hypnotherapists on what they can do.
Well, I think that's it's living in that world, living in your world. I mean, I don't believe there's one person watching this whose lives haven't been touched in one way or another by cancer.
No, as I said, one in two,
So,
50% of the
yeah,
population are going to experience it. So
yeah. So it is such a huge and very emotive subject.
Yeah.
And hypnotherapists, we work with emotions. So
Yeah.
there is hope for you. So, Garry Coles, thank you very much for your time.
Thank you.
If you're enjoying these podcasts, hit that subscribe button down below. If you're not, send me a message why, and we'll make them better. Garry Coles, thank you very much for your time. Hypno-Oncology.com, and see you all on the next one.